Hello, everyone, and welcome to the presentation on the 6th edition of the Helping Skills textbook, Helping Skills Facilitating Exploration, Insight, and Action. Thank you for being here. Okay, so my name is Dr. Judy Gerstenblit, Judith Ann Gerstenblit. My co-authors are Clara E. Hill and Harold Schwee. I'm representing all of them here today, and it's great to be with all of you. So this is the front cover of the textbook, and in case anybody wants to scan the QR code and just pull up the book right now as we're going through the presentation, if that would be helpful for you, feel free to go ahead and do that. So the core question that motivated the writing of this book is, how do we train beginning therapists to provide effective psychotherapy to their clients or patients? And think about yourself if you're a mental health professional. The first time that you walked into a room to meet with a patient, to meet with a client, how are you feeling internally? I imagine there might have been some anxiety going on, heart racing, a little bit of sweating. It can be a pretty anxiety-provoking situation to step into that. So how do we help people initially as they're thinking about, what does it mean to be a therapist? What does it mean to be a helper? What does it mean to be in the room with someone who's really seeking help and really maybe needing help, maybe in crisis? What do we do, and how do we train those folks to help them? So there were some early helping skills programs and theories. We're not going to spend too much time on this, but Karkoff's human relations training, Ivy's micro-counseling, and then Rogers, Carl Rogers, who I'm sure many of us are familiar with, who initially thought that skills could be taught. And paraphrases, for example, were able to show clients that you were really listening to them, you were really hearing what they were saying, and you could mirror back to them what they were saying. You could show them empathy. But he actually later became disillusioned with skills training, and he postulated that facilitated conditions in and of themselves, right? So empathy, genuineness, being congruent, and unconditional positive regard were necessary and sufficient, right? But our current research shows that all of those facilitated conditions that help to build a therapeutic relationship are critical, are very important, but are not sufficient, right? So the therapeutic relationship is indeed associated with therapeutic outcome, but it's not sufficient. We also need to be doing something in the room. And also we can think about, how do you even build a therapeutic relationship? You are using skills to build that relationship. So we'll come back to some of this. But Clara Hill, Dr. Hill, developed this model with the first edition coming out in 1999. And we've been adapting this model over the past 26 years. This model is based on lived experience, what it's like to actually be a therapist, to be a supervisor, to be a client, to be a teacher. It's based on empirical evidence, evidence-based research, and it's based on extensive feedback from students and from colleagues. So there are really three components to this model: exploration, insight, and action. Exploration is based on Carl Rogers' person-centered, client-centered theories, as well as broader humanistic theories, with the goal of helping clients fully and deeply experience their thoughts and emotions and experiences. Then we have insight, which is based on psychodynamic and existential theories. And insight, the goal of insight is to help people develop an understanding of their patterns and their way of being. And then finally, we have action, which is based on behavioral and cognitive behavioral theories. And the goal of action is to help people make meaningful and enduring change in their life. So just to give you a few examples here, and in a moment, I'll show you all of these skills, but in exploration, we teach skills like asking questions for thoughts, reflecting feelings. In insight, we're teaching challenges to foster and raise awareness, interpretations, things like immediacy to work directly and honestly and openly on the therapeutic relationship itself. And then action, things like giving information, giving direct guidance. So some examples of skills. When you think about that, what crosses your mind? Or if you want to reflect feelings, you might say, it seems like you're really terrified right now. Here's a fun challenge. You say that you're handling everything well, but it really seems like underneath the surface, you're kind of falling apart. If you want to talk directly about the therapeutic relationship, you might say something like, I feel like you're pushing me away from you right now. Action. I encourage you to keep a journal of your food intake over the next week. So we're not going to go through all the skills, but I just wanted you all to see a snapshot of this in one table. So we have the goals, exploration, insight, action, sub goals, what we're trying to accomplish with each of those, and then the associated skills. So I'll give you a moment to look through that. Okay, so in terms of the book itself, the Helping Skills textbook, there are 5 parts to this textbook. So part number 1 is just foundation of the helping process, introduction, what is this helping skills model, what is it even all about, cultural awareness, self-awareness, as well as a whole chapter devoted to ethics for beginning helping professionals. The next 3 parts cover those 3 components, those 3 major goals of the model: exploration, insight, and action. And each of these parts contain an introduction, an overview of that goal, as well as the skills for facilitating that goal, and then an integration chapter where we bring together all the skills in conversation with case conceptualization, as well as guidelines, tips for beginning helpers, and maybe even challenges that you might encounter as a beginning helper. And finally, I think this last part is very important, actually applying the helping skills in practice. So it's great to do this in the lab, it's great to do this in a beginning helping skills class, but what does it look like in practice when you're with a client in front of you? How do we implement the skills? So the beauty of this book, I think, the beauty of this model is that we're really teaching these skills in context. It's not just, can you paraphrase what someone said, right? Or can you give an interpretation? But can we understand theoretically what is going on for this client, what they might need in that moment, and how can this intervention bring them a little closer to their goals and what they might need? So we're teaching this within the context of theory, case conceptualization, cultural and self-awareness, those facilitative conditions that Rogers postulated, as well as really important timing and responsiveness and flexibility. Absolutely critical to this textbook, Helping Skills. It's not a cookbook. There's no recipe. There's no one right way to be a therapist or to deliver an intervention to a patient or a client, right? There's so many different skills that we could use in any particular moment. And we teach our students, every therapist is different. Every therapist has, based on their own personality, their own style. And then every client in front of you is different. So you're really developing an individual therapy for that particular client. So we teach the skills to give a framework, and then we adapt and adjust in every moment with the client. So what is the empirical foundation for the effectiveness of the helping skills model? In short, it is effective and empirically supported. We have several studies that show that students who are using these skills increase in their own self-efficacy over the course of time. They even maintain this self-efficacy 5 years later when we surveyed them about their skill use and their confidence in using the skills. They increase their use of exploration and insight skills, and they reduce their time speaking and actual words spoken. And we can think about this as, people who are kind of coming into a beginning helping skills class might be operating under the model of a typical relationship, right? A friend relationship where it's probably much more mutual. But then they have to learn, okay, what does it mean to be a helping professional, to be a therapist? Really, the focus is on the client. We're going to give the client more of the time, more of the space to speak. We've done some research on the effects of trainers, so teachers, instructors who are teaching this model, and trainers account for 7% of the variance and increases in trainee self-efficacy. And we found that it's best if trainers are authoritative, not to be confused with authoritarian, but authoritative, where they're setting clear expectations and they're providing clear but reasonable demands. And again, I just want to highlight that trainees maintain their skills even after 5 years. So we're teaching this course, this book is often used in beginning helping skills courses and undergraduate classes and graduate classes. For undergraduates, usually higher level undergraduates like juniors or seniors, third or fourth year students, and then graduate students usually in their first year, sometimes even their first practicum course. And they're maintaining these skills even 5 years later, especially if they're continuing to get training as mental health professionals. So some effective components of training based on Bandura's social cognitive theory. Instruction, that's a combination of instruction and modeling. Instruction, modeling, practice, and feedback. So instruction, we can think of, lectures, reading the textbook, things like that. Modeling, actually watching an instructor maybe do a role play with a student, watching therapy demonstration videos. Practice, where the students are actually practicing the skills themselves with volunteer clients. And then feedback, they're hearing feedback from their instructors, from their clients, from their friends, from their colleagues about how they're doing. And the reason why practice is started here is because students consistently say that practice of these 4 is the most important component, most effective and important component to them learning these skills. And this really aligns with the current research on deliberate practice as well. So we highly encourage, the textbook is great, but you need to bring it even beyond that. You can't just read the textbook and then you'll be able to know how to use the skills. You actually need to practice the skills. So we've established that the skills training is effective. It's good to really get a handle on the skills and then to start kind of weaving in more of this case conceptualization, thinking about the actual client in front of you. And the idea is that once you have the skills in more of a competent place, they really recede into the background. And you can think of how this works with any kind of skill that you're learning. Once you get more and more practice with it, you don't have to think through every step of it, right? Think about driving. If you drive, you don't have to think about, let me turn on the car and let me put my foot on the brake and that kind of thing. So with helping skills as well, more experienced mental health professionals, more experienced therapists don't need to think about, okay, the client just said this thing. I want to make sure that I am showing them that I'm supporting them, that I'm providing empathy. Let me figure out how to restate what they just said so that they feel that, right? We just kind of do that intuitively. But for beginning helping professionals, they kind of need to think through, they are thinking through those different parts of it. Back to Rogers, we really can't separate the skills from the therapeutic relationship, right? So we need to learn the skills. This approach is really helpful in providing a feedback, providing a framework for beginning trainees. So again, beginning trainees, when there's all that anxiety, it's helpful to be able to hang their hat on something and to say, okay, yeah, I have different skills that I can use when I'm in the room with a client. But again, we don't hold on to this too rigidly. We want to make sure that people can adapt the skills to their own style and to the client in front of them. So again, the first version of this came out in 1999. It's been coming out about every 5 years since then. So the 5th edition came out in 2020, and the 6th edition hit the shelves at the end of 2024. So just want to cover some of the main changes that we made from the 5th edition to the 6th edition for those of you who are familiar with the book. And then we will wrap this up and I'll take some questions. So some major changes, first of all, 2 new authors, myself and Harold Shui. So some new perspectives, some new cultural backgrounds coming into play. We have moved from a stage model to a goal model. So I talked about exploration, insight, and action. Initially, we thought of those, or we taught those as stages of therapy, but we really don't think about it like that anymore based on our research, based on our lived experience of being therapists as well. Therapy does not happen chronologically or in a linear fashion like that, right? So most of therapy we found, therapists are using exploration skills sprinkled in with some insight and some action when it seems appropriate and helpful. We have lots of new empirical evidence about training students using these skills and how these skills actually look in real psychotherapy. We're covering culture and multiculturalism more in this 6th edition, and we have updated examples. Furthermore, we're trying to make this more friendly for instructors and for students. So we've incorporated lots of changes in terms of being really clear with learning objectives, including self-reflective exercises and activities, and overall just giving a lot of opportunities to actually engage experientially with the material. And again, lots of resources. So we have chapter summaries, practice exercises. This is all online on the website. Practice quizzes, student labs, web forms, a checklist of emotion words. And we even have some therapy demonstration videos. This is the older version, but we have a newer version coming out. And I see Ed in the audience here. We just filmed our new version of the Helping Skills in Practice video. So this new video is going to be coming out in January 2026. So definitely be on the lookout for that.